Hi everyone, my name is Taylor Green. I'm one of the audiologists at Audiology Associates. It's just myself again today. You're probably wondering where Reese is. He hasn't gone anywhere. It's just been a bit of an awkward time at the moment. As in, we haven't really got much time together, so I'm doing some of the voiceovers again this week. We will be back together soon. I know I said this last week, but we will be back together soon. Now there's 3 videos in this compilation, and we've got myself, which is the first one you're looking at here. The second one is Katie's, and I believe the last one is Reese's. So you've got a bit of all of us today. Now you can see I've got this plug, essentially. I've got this really soft plug that this patient's presented with today. Feeling a little bit blocked up, like kind of intermittent. So this has been moving around a little bit inside the ear canal. And you can kind of see why it's been blocking up this patient's ear canal. We've got quite a lot actually. It was more than what I was expecting. Now we've got the standard size Zollner tube, which is the larger of our suction tubes. We only tend to use 2 different sizes in our clinics here. The smaller of which is called the fine end. Any regular viewer will obviously know this because we've mentioned it thousands of times. But we're almost there. We're just going to give this a bit of a wiggle now. We're just coming to the entrance. We're right at the entrance of the ear canal here. See, it's quite dark as well towards the back end of this plug. Now the darkness the colour is usually a sign that's been there quite a while. So this could potentially have been, possibly a couple of years old. We just got a couple of little bits left to just mop up here now. Patient already noticing a big difference. It doesn't always be, sorry, I got my words right. It's not always the hearing which improves, but a lot of people feel the sensation improves as well, because a lot of people get that sort of blocked up feeling. It's a pressure, which is not comfortable in most cases. I mean, it's, we get patient to use olive oil before coming in. If your wax is quite hard, you will more than likely feel that pressure. The olive oil tends to soften the wax, which can ease off the pressure feeling. But in most cases, it tends to block you up more, because the wax tends to absorb the oil and it tends to swell and increase in size, which is why some people tend to turn up with, after they've used a lot of oil, saying my hearing was pretty good at one point, but I've used the oil and now it's got worse. So we've got just under 2 centimeters there, 3/4 of an inch. So we've got Katie's patient here now. Now this is the very first time I'm watching this. Now I'm watching this as live as what you were watching right now. So it looks like we've got a foreign body, if I'm not mistaken. Now it doesn't look like cotton wool. You can see how easy that kind of broke away there. I've had a very similar case in the past, but this looks like tissue paper. Because of you can see it's got like that kind of surface where it looks yellow. That is usually where the patients use some drops to try and sort of soften what they think is wax. I can see Katie's got what looks like the Rosen inserter here. I might be wrong. It might be the Rye hook. No, that's definitely a Rosen inserter. Always tricky, these tissue paper, especially when the patient has used drops or has had multiple showers or baths before getting this removed. As you can imagine, like any sort of soft tissue paper, when it gets wet, it gets very kind of mushy, and it's difficult to remove with forceps then, because a lot of the time it breaks little tiny bits away, and if it's very compact and very tight, it's a bit of a nightmare, because you normally just get little tiny bits away, and then you eventually create enough space around the tissue paper to get that moving all in one go. So you might see this with Katie's here. So as we're taking away these little bits, Katie might get a really good grip at one point, and you may see all of this come out in one go. I might be completely wrong, because I haven't looked at this video before I voiced it over, so I do apologize if I'm wrong. Oh, now that was a good little maneuver there, going from underneath. It's loosened it right up. So forceps again now, yep. it's a really awkward angle to try and get that bottom bit, because you try to keep the forceps straight, but you've almost kind of got to tilt it downwards to get the right angle. But with the camera in there as well, it's very difficult to get that angle. It looks, I'm not quite sure what, oh, that looks like a bit of blood at the back of there. Is that, yeah. Oh, now that is cleaner than what I thought it was going to be, because you could see there was a little spot of almost what looked like dried blood, or it could have just been a scab where this patient has gone in with the paper and has, you know, gone in a little bit too aggressive. But I was half expecting that to be quite butchered, as in like a little cut across, not butchered, you know what I mean, a little cut across the side of the ear canal. Was almost kind of expecting there to see a bit of active bleeding as well, but it looked pretty good. Katie done a good job there, to be fair. And this is Reese's patient now, so this is the last patient in this little compilation. Ooh, it looks like we've got a pretty solid type of wax here. Completely full as well, fully occluding this ear canal. Can sometimes be quite easy to remove, but this one looks like it's got a lot of hair trapped within it, which if you have seen our channel before, then you'll know removing this type of wax with all this loose hair kind of matted amongst it, you struggle to get a suction grip. Now, manual tools tend to be a bit better with this type of removal. Oh, I honestly was expecting a lot more than that. Now we're going to finish up here with the suction just to clear up that little ring that you can see in there. Now that usually, because it's almost crispy in a way, you might see this come away in one go. I'm hoping that's going to come away in like a little ring. Oh, look at that visual. That is always difficult when it's quite hairy at the entrance, especially with those really dense kind of thick hair. Ooh, that's a lot of this is dry skin, so this is not wax here now, so this is a lot of dead dry skin. I mean, it doesn't look dry because I think the patient's probably been using some oil or something to try and soften this up a little bit. Very difficult when it's dry again, because again, as I've already mentioned, you tend to struggle to get a grip with the microsuction, and with you being this deep inside the ear canal, I mean the eardrum is literally right in the center of that ring. I think we just need to try and get that top section loosened up as well, and that should all come away quite nicely. I think that's probably going to shear away. I might be wrong. There's a good job there. Top left, yeah, still there. Oof. Got to be very, very gentle when you're this far inside the ear canal. Oh, it's peeling away okay. This area that we're in, so this deeper section of the ear canal is essentially a layer of skin on bone. It's very, very thin, and it can be very, very uncomfortable if you're not careful. So if you end up touching or prodding or poking the ear canal when you're this deep, you're bound to get some form of jump or flinch. It kind of catches you by surprise, especially when the wax is really wet and soft, because you try to sort of gauge where the ear canal is at all times, so you can obviously be as safe as you can. But we're sticking with the forceps here. I think that's going to peel down over the front of the eardrum. You can almost see there's a very, very small section of dry skin just on the surface near where the umbo is, which is the dead center of the eardrum. There we go. Oh, you got to try and peel these away without it breaking apart, because if it leaves little tiny bits in that little recess, which is the sort of slight widening of the ear canal as you get just in front of the eardrum, very difficult to get down in that area. We can get down there, but a lot of the time, because the camera can't quite go that far, in some cases you're almost not having to go blind, because we would never go blind and make it unsafe, but you almost kind of rely on the sound of the suction rather than you actually being able to see that wax moving. So it can be very, very difficult. So we're just peeling that last bit away there. It's come away quite nicely. Yeah, I would have done the same thing there. But very difficult. Those little tiny pieces of thin skin, they can clarinet quite a lot, which regular viewers will know exactly what clarinetting is. But if it's your first time watching, clarinetting is essentially where the suction tube tries to grab very thin pieces of skin, and it makes this horrible shrill whistling noise. And it's, you know, we're inside the patient's ear, so it's loud for the patient, and it's very loud for us as well. So we got 3 centimeters there, just over 1 inch, sorry. Thank you very much for watching the video, guys. Don't forget, if you do enjoy these videos, you can like, you can heart, you can share whatever platform you're watching on. It really does help the channel. And we shall see you on the next video. Thanks, guys. Bye.